Department of Anesthesiology in BR Life Hospital, Udupi. To mention a few professional skills, Sir has an expertise in providing basic life support, advanced cardiac life support, trauma life support, ventilator management, and many more. Thank you, sir, for accepting our invitation and to agreeing to present us with the topic prone position for oxygen and awareness on black, yellow, and white fungus. The committee organizes multiple webinars consistently for students to create awareness and to gain insight and information that would remain effective in their life. I believe this webinar will be helpful for all of us present here. Thank you. Stay home and stay safe.
Thank you, Pratibha. Now, I request our beloved Dr. V. Shetty, sir, to take over the program.
Yeah. Good evening, everyone. So I would like to start with COVID as we are presently in a pandemic. And today's topic is about proning, which is for ventilation and oxygenation. And also I'll be talking about mucormycosis, all this all black fungus, yellow fungus, all those. We are basically a disease that happens in COVID-19 patients. To start with prone positioning, I would like to start talking about what happens in COVID-19. It's a multi-organ dysfunction, but majorly it affects the respiratory system, that is the lungs. So as the virus affects the lung, that causes pneumonia. Pneumonia is a chest infection that can occur in the patient, because of which there can be various symptoms. As it's a viral infection, there are common symptoms such as the patient can have lethargy, or as we say, tiredness, or the patient can develop fever, and the patient eventually can start developing symptoms like breathlessness, like he may have difficulty breathing, as we know. And oxygen is a main metabolic substance that is required for the for sustenance of life, as oxygen is required in many oxidative phosphorylation, such things. So we need oxygen for survival. And as lungs is the major organ that supports us in oxygen transfer from the environment to the body, we need oxygen, and as we breathe, we take in oxygen from the environment. And the fraction of oxygen in the environment is 0.21%. So, and the lungs in COVID-19 patients, they are not able to survive on that percentage of oxygen. So normally what we do in ICUs, we give them a higher percentage of oxygen. So if we give 100% oxygen to that patient, the body is able to take up that oxygen, and the saturation that is that we see in the patient will get better. In COVID-19 patients, usually saturation drops down. In a normal patient, saturation should be 100% or above 95%. And usually because of COVID-19 infection, there is damage of the lungs, because of which the patient is not able to maintain that oxygen levels in the body or the blood. So in such cases, we give them face mask oxygen, in which there's usually 6 liters per minute, or there can go up to 17 liters per minute on a face mask. As it is 100% oxygen, that is 5 times more from the atmospheric air. Our main goal during oxygenation is to make sure that patient saturation is above 95% or above 92%, so that he can breathe on his own, and he's able to manage his organ functions. As I said, normal atmospheric oxygen percentage is 20%, around 21%, and we are giving 100%. So the patient requirement has increased to five folds. So in these conditions, what we do, we try to make sure that we give other medications like steroids. We give antivirals like remdesivir, which you could have heard. These antiviral medications, they try to destroy the virus so that the lung damage is reduced as much as possible. In general, COVID-19 is the problem that the patients face is an inflammatory condition. Like once the virus has entered the body, it causes the body tries to destroy the virus by producing antibodies, and we call it inflammation. And this inflammatory stage can be very much. So that may in turn destroy or start damaging our own body. So we give steroids to contain that inflammatory stage. And because of this high increased use of steroids, that also reduces the immunity of the body to normal pathogens that usually don't affect us. So that is why all this mucormycosis or fungal infections have increased in this day and age because of COVID-19. So coming to proning, normally we tell our patients who are at home or who are in ICUs or in wards, then we measure the saturation with the pulse oximeter. And those pulse oximeter readings usually should be above 92% or 95%. So there are various ways in which we can manage the oxygen levels in our body to be elevated. One is by giving external source of oxygen, like in patients who are at home, who are not able to get beds or who don't require an oxygen or require aggressive treatment. We tell them to stay at home, or if they're in wards, we give them oxygen. If they're at home, they can use an oxygen concentrator or an oxygen cylinder with which there's external supply of oxygen, by which the patient can maintain a higher saturation. And the other things that we can, over this, what we can do is we prone the, there are various methods in which one of the methods is proning. Proning is basically, we tell the patient whose saturation is low or who are recently infected with COVID to sleep on their stomach with their hands, like we try to tell them, keep their hands above their head and sleep on the bed with face towards one side and their chest and abdomen lying on the bed. Basically, we do this proning position because as we breathe normally, there is movement of chest and forwards and sideways. But when the patient is sleeping, because they are not able to sit up, they are usually on the lying down position. The back side of the lungs are not expanding. So we try to tell the patients to lie down on their stomach, so that there's expansion of the lungs of the back side. Yeah. So that all over the lung fields are getting used during breathing. And because of that, there's better oxygenation. So the patient can develop COVID-19 infection on either left side or right side. If there's extensive damage over the left side, then oxygenation will be very less on the left side. So if the patient sleeps on the left side and so that the lungs on the right side are active more, so at least oxygenation will be better. So these are some position changes that the patient can do himself in the wards or in their house once they're infected. Because usually we did get an X-ray done or a CT scan done in which we can see the lung damage. And the concerned physician is either from medicine or anesthesia or any pulmonologist. You can consult with them and ask for guidance over how much the lung damage is and which positions are more comfortable for the patient, so that oxygenation is better. And as I said of proning, it's better to change the position of the patient regularly, so that overall lungs are getting ventilated. By ventilation, I mean there's oxygen movement to the lungs. So there's better ventilation of all the lung fields, which can in turn help the patient to have a better oxygenation and a better saturation. This is what I wanted to talk about prone positioning. And in general about fungal infections that occur in COVID-19 patients. As I said, the patients are on various medication. They are on vitamin supplements, they're on antiviral treatment, and they're on steroids. And because of extensive use of steroids in these patients and for a longer duration, because normally COVID, when we use steroids, it's only for a shorter duration of time. Because COVID-19 is a extensive lung damaging infection, we use steroids for a very long time, and we use a very, very high dose, because the inflammation that is caused by the COVID-19 infection is so harsh that but we need higher dosage of steroids to curtail that inflammatory response by the body. So because of this higher dose of steroids like methylprednisolone, dexamethasone, hydrocortisone, these are certain these are steroids that we use against in COVID-19. And we give these doses, usually we give a dose for only single dose for 1 day. In COVID-19, we are giving thrice daily in such patients. So the steroids also, effects of steroids on the body it reduces the immunity. Basically, the inflammation is the immunity of the body trying to damage the virus, which in turn also destroys some of the human cells, like lung tissue is causing damage to the lung tissue. So we want to reduce that inflammatory stage. So we are giving high doses of steroids. Uh, so because of that, there is lack of immunity, at which all these opportunistic infections like fungal infection, they all come into the picture. So there is mucormycosis, which is one of the common fungal elements that are fungal infections that are causing lung damage. These fungal infections start from the nose and oral cavity, and also. So when there's fungal infection, there is necrosis of the tissue of the nose. Inside the nose, there are turbinates. Commonly, it affects the inferior turbinate, or the nasal mucosa is getting damaged, which in turn causes more distress to the patient because it's an superadded infection. Over the viral infection, there is fungal infection also. And to encounter this fungal infection, we have to give them more antifungal treatment, which and overall these treatments, they take a toll on your body. They can cause damage to your liver. They can cause damage to your kidney. If the patient already has a liver damage or kidney damage, in those patients, it's more, it damages the kidney and the liver more. So these are the problems that we encounter during the treatment of COVID-19. So there is aspergillosis. These are also other various fungal infections that can occur in a patient on steroids. These steroids cause an immunosuppression kind of condition, during which there is infection of these fungal elements. Normally, before steroids, usually patients who are on who have cancer, who are on immunosuppressant treatment, and patients who are HIV positive, in those patients there's immunodeficiency. So these infections were only limited to those conditions. But now, because of the overusage of steroids, which is required, that is causing all these opportunistic infections. So early diagnosis from our side would be patient will start having lethargy, when he will be starting having breathlessness or breathing difficulty. So these are the problems that occur in such patients. So normally from our side, if there's any necrosis or blackish discoloration of the nose, or there can be blackish discoloration below the eye, these are all signs of the patient is going or started developing fungal infections. In such patients, we start them on antifungal treatment, and treating a fungal infection takes a long time. So if the fungal infection has become very extensive, then the patient may require surgery also. So in such cases, we'll take the patient to surgeries, and concerned ENT specialists, that is eye specialists, they do surgeries, and they also call in ophthalmology, who are eye doctors. They try to debride the necrosed tissue so that they can decrease the amount of infection that is already there. So persistent, and they may require surgery 2-3 times. But if there's sufficient decrease in the necrosed tissue, so there's sufficient decrease in the fungal elements, that can help in the treatment of help the patient to become better. And the requirement of antifungals also will come down. This is what I wanted to talk about, the mucormycosis. And it is called black fungus because it causes necrosis. And when there is necrosis, there's cell death, because of which there is a blackish discoloration of the skin and all those elements. And other yellow fungus, all those basically they are fungal elements. When they start growing, they cause tissue damage. That is why all these colors have been told. Yes. Then anything else, any other doubts that you wanted to ask, you can ask.
Good afternoon. If anyone has any question, please you can ask the questions now.
Hi, doctor. This is Giridhar.
Yeah.
What may be this next symptoms for this third wave? About this one?
Okay. Third wave, the symptoms will be almost same, but as for the epidemiologists are telling, the rate of transmission and mode of transmission will be same. That is, it's a respiratory droplet infection. So everybody has to wear masks. If possible, wear double masks when they're going outside. And it's very highly important that people get vaccinated, because once people are vaccinated, the immunity in general in the population will get better. And the risk of transmission, or even if you get a COVID infection after that, the symptoms that you will develop will be very less, far less. So I know some people are apprehensive of taking vaccination, but vaccinations are very important. It's better from your side. People may feel like it's just an effect of the vaccine, which is helpful for your body. And the second thing is social distancing is of main importance now in this day and age, because the rate of transmission of the new variant that is called Delta Plus variant is very high. So the sudden increase of cases may happen, considering that the amount of cases that can happen, because the new variant could be 5 times, 10 times more than the second wave, because this particular virus has mutated itself so that it can spread faster. So social distancing is very important. Vaccination and wearing masks, and those are very important at this stage. And maintaining a good hygiene and keeping your environment some hygienic is also quite important. Even during fungal infection, all this mucormycosis or fungal infection cases, they tend to grow more in humid conditions, damp conditions. So it's better to have hygienic conditions around you, and maintaining very good hygiene, and talking to your concerned physicians as soon as you develop any certain symptoms, such as fever, if you develop breathlessness, if you develop any if you were able to do a household work, such as you were walking for 1 kilometer, 2 kilometers, or if you live in the third floor, when you were able to walk without any breathlessness, 3 floors or 2 floors. But now if you start developing breathlessness at that stage, it's better to consult a physician. And in general, we give multivitamin tablets, so that any immune boosting treatment that you can take is better. Start exercises at home. Exercising develops your immune system, makes you less like the virus affecting you will be much more lesser. Yeah.
Good evening, sir. So there is a question in the chat box. I hope even you can see. I'll just read out the question. Yeah. What science is involved in predicting virus related to age groups? First, it was above 60. Second, it was about around middle ages. And now they are giving in the third wave, it will be predicted for children. So they're asking the question is like what is the science is involved in predicting these viruses?
like which age group they are getting affected under. Yeah, so when it came in the beginning, COVID-19, they were suspecting patients who are more susceptible to the diseases, because old age people are more susceptible because their immunity will be less, and they won't be able to tackle all this like breathlessness. If younger patients are able to tackle these symptoms, because they are more active, and in general, if we get any infections, we are more stronger to fight off those infections. In older age groups, it is difficult for them to fight off these infections. That's why in the first wave, they thought older age group are more susceptible to diseases. But in general, the infection caused by COVID-19 became stronger after once its mutation started happening. So now also patients who are in older age group, they're getting affected and they're at higher risk. Once an older age person gets infected with COVID-19, the infection is very strong, but the spectrum of disease with COVID-19 is very large. Like there can be patients who are asymptomatic, patients who can develop mild symptoms, they can develop moderate or severe symptoms. So because recovery from these symptoms is also very high. Around 99, most of the patients will recover. Some of you might have even gotten the infection, but develop any mild, you may have developed a cold or you developed some mild fever and you would have recovered. But in some patients, the symptoms are very high, about high risk. They develop high fever, they start developing desaturation. Saturation would drop from 9500 to 80%. So that was happening in the first wave. Now, because the infection has become more stronger, even patients of middle age group are developing symptoms. Because the mode of transmission and the spread of the disease is very high. So during mid-April and May, the amount of infection had increased to exponentially. And now there's a downward trend. But in the third wave, they're suspecting pediatric age group because most of the older age group has been vaccinated in most of the other countries. And in India, vaccination is going at a slower rate, but most of the people are getting covered. So the idea is the older age group and the middle age group will be covered by vaccinations. And the majority of the people who are not vaccinated is the pediatric age group. So that's why they're thinking pediatric age group may develop symptoms. But in general, there are pediatric children who are getting infected by COVID-19, but the symptoms are not very severe. So we are suspecting there could be cases in the pediatric age group, but still third wave will not be limited only to the pediatric group. It will definitely cause infections in the older age group and still will cause infections in the middle age group. And patients who are already infected with COVID-19 will start developing fibrosis. Fibrosis is basically damage of the lung tissue. It's like if you develop a wound, you start developing a scar. And over time, that part of the scar will heal and it become as normal tissue, that normal skin will come back. Same way, there is damage to the lungs and that causes scarring of the lung tissue, which eventually over a period of time, which usually it is 6 months to 12 months. It will take around 6 months to 12 months for the damaged lung tissue to go back to its original functioning. So patients who are already having this disease cause fibrosis, if they get infected again, they will have much more severe symptoms and they'll have a worse outcome. Yeah.
There's one question. Which specialist should we have to visit if we have any kind of funguses or something? Which kind of specialist doctor should we have to approach?
Yeah. So specifically to COVID-19, it's better to go to a hospital. In the hospital, there's physicians there can be a doctor from, even an MBBS doctor can guide you to the concerned specialties who can tell you where to go. In the specialties, in the hospital, it's always managed by medicine and pulmonologist and anesthesia or any critical care medicine specialist. In the ICU, in general, usually there are anesthesia people who manage the ICUs because there's ventilatory management and there is also medical management that is required. If you're going to an OPD base, usually you go to a hospital, you will be treated by a duty doctor who usually will be a medicine, or there will be a MBBS doctor who will see your symptoms, and seeing the severity of your symptoms, they can either send you back home with adequate medication, or they will ask you to get admitted in a ward. If your symptoms are very high, then they will shift you to an ICU or intensive care facility, where you will be treated by a physician or an anesthesiologist or a critical care medicine specialist. Pulmonologists also will come in those conditions where they will there are various investigations that has to be done. There will be baseline investigations like hemoglobin, their WBC count, because there's infection, there will be elevated WBC count, platelet counts, and there will be, because COVID-19 patients have a higher risk of having heart attacks, or they may have a stroke, any brain damage. There's very high risk in those cases. So we'll do general workup, and there's chest X-ray to see how much infection has occurred in the lungs. And normally we do CT scans, because it's a gold standard investigation in COVID-19, which will accurately tell the severity of your disorder. So for this, there's a group of doctors who are all involved in treating a patient. So in general, for a layman, who we will approach is a general physician or a pulmonologist.
Okay, sir.
Yeah.
There's another question. Without any symptoms of corona, but if still a patient can suffer from fungal infections, if there is any idea, sir, that is like even without any symptoms of corona, do people get this fungal infection?
Normally you don't. As I said, fungal infections are caused in patients who are already immunosuppressed or who are on high dosage of steroids. If you're a patient who's a cancer patient on immunosuppressant therapy, that would have reduced their immunity. So in such patients who are asymptomatic, they may develop antifungal infection in general. But if you're a healthy person, young or old, and you have developed COVID-19 and you have been asymptomatic without any steroid therapy, we are very unlikely to develop any fungal infections.
So next question, why do people test positive even after 2 months of recovery from COVID?
Yeah, so because COVID-19, there can be reinfections. Just because you developed infection once doesn't mean you cannot get reinfected. Like even vaccines work like that. In vaccines, you are giving the DNA or RNA of protein of the vaccine virus into your body, which the body will feel as an infection. So it will develop immunity against it. So the next time the infection happens, body is prepared with antibodies to fight off that virus. That is what is happening in the vaccines. So if you're exposed to a higher doses, higher amount of virus, again, in the meantime, so reinfections are very common. That is why you may still develop, you may be positive after taking treatment. Even after 1 year, if you're exposed to COVID-19 and your body is not able to fight off the virus sufficiently, then you may still come as positive with COVID-19.
Thank you, sir. The next question is, are only people who have symptoms are being infected for lung issues, sir, for the fungus and things?
Yeah, I didn't get you. What?
Are only people who have symptoms are infected for this black fungus and white fungus?
It's not just symptoms. Just because you've been exposed to COVID-19 or corona, you will start getting all this fungal infection. It is because of the long-standing usage of steroids. And if you're a patient of diabetes, uncontrolled diabetes, in general, these patients are prone to developing secondary infections. fungal infections that have started happening if patient is already having other comorbidities because of which the immunity has suppressed. If the patient is an old cancer patient or a diabetic patient whose sugars are not controlled, if the patient is on steroid therapy for a long duration of time, for like more than 10-14 days, over 50 days. So if the patient is in the hospital for a long duration of time, those patients are more susceptible to fungal infections. In general, a healthy patient will not develop fungal infections.
Okay, sir. So the next question is, what if a person is affected from or infected from COVID? He's got recovered from it, tested negative, and still he suffers from cough.
Yeah.
Is it due to lungs damage or something? Or what is the preferable thing we can do immediately when he finds still cough?
In that cases, it could be an upper respiratory tract infection that is persistent. Like in general, patient can develop cough because of other things also. So in that case, just go consult a required physician. And they will see again test for COVID-19. If it is positive, the consent treatment will be followed. In general, just because if it's just mild cough, you don't have to be worried. And as I said, COVID-19, just because you have recovered doesn't mean there's no COVID. Body has to recover. There's so much damage to your lungs, upper respiratory tract. Your airway is damaged. It will take almost 6 months, 12 months for your body to become back to the original condition. But even after that, there can be sufficient damage that you may never recover 100%. The body will do its best to recover from the damage caused by corona or COVID-19.
In such cases, is it preferable for them to be isolated, sir?
If just because they have a cough, that is not required. Better to wear masks and go to the hospital and get your COVID-19 test done again. If it is again positive, then isolation is a required treatment if there's no severe symptoms.
Okay. So next question is, there are instances where the middle-aged patients' platelets have come down after COVID treatments. Yeah. Is it because of the side effects of medicine or is it for any other reason?
Normally, as I said, the patient may develop heart attacks or they may develop stroke. In such patients, we give anticoagulants. Anticoagulants are the stroke or heart attacks usually happen because there's clot formation in the blood. That clots can go to all the small blood vessels that are transferring oxygen to all this tissue, like the brain or the heart. So any of those small blood vessels, this clot goes and it blocks it. It's like a pipe that is supplying water. So imagine any cloth or gauze that clogs it. So no water will go supply beyond that block, there will be no supply of water. Same way, if this clot goes and blocks an artery, there is no blood that is getting transported to the tissue, because of which there is no blood, there is no oxygen, and there is tissue of that death of that tissue. Same thing is happening to the heart, and same thing is happening to the brain or any other tissue organs also. So to prevent that, we are giving blood thinners that prevent this clotting from happening. Because of and if it's for a very long duration of time, that may cause reduction in platelet counts, all that stuff. But if there's any reduction in platelets, we usually do investigations every third day. We'll always obviously catch the reduction in platelet, and we can give platelets from the outside. Like there is blood transfusion, we can give platelets also to the patient. So even though there's reduction in platelet counts and it is caught by the investigation, we can treat it effectively.
So again, another question. The upcoming virus is something called as Delta Plus, isn't it, sir? Is it again going to affect through your funguses? We have list of funguses. Are there going to be any more colors of funguses will be produced from the Delta plus or delta virus, whatever is going to come, or it is on its way?
It's not that the virus is causing the fungal infection. The virus is just causing lung damage because of as we are using steroids, high dose of steroids, that is causing all these opportunistic infections from happening. The virus will only infect the lungs. This will not cause any all these fungal infections that are happening have already been there before also. As I said, all these cancer patients who are on immunosuppressant therapy, and who are patients who are HIV patients or any diabetic patients who are uncontrolled infections, they are prone to all these opportunistic infections. So these fungal infections have always been there. So just because there's a new variant, that doesn't mean there will be any extra fungal infections. All these different color infections are basically just different species of fungus that are causing infections on these patients.
Audience, you find any questions? Any other questions?
Sir, as this current situation is there, vaccination is mandatory, and after vaccinated, we get fever and body pain. Why is this this type of disease?
Yeah, as I said, when we are giving a vaccine, it is basically the viral protein, which is less virulent. When I say less virulent, it's less infective. So we are giving a protein that we have genetically removed from the COVID-19 virus. That has been, when we inject a vaccine to the body has to develop an antibody. So when an actual virus goes, the amount of inflammation that happens will be much more higher. Yeah. When we give a vaccine, the inflammation will be very less, and it will be in a controlled manner. So there is uncontrolled inflammation and controlled inflammation. When we give an vaccine, that is uncontrolled inflammation that the body can fight off or body can sustain. So the first time you take a vaccine, you develop an amount of immunity against the virus. So because it is that is how the body is fighting against the virus, you will develop certain amount of body ache, or you will develop fever, mild fever, which is much better compared to the massive infection, massive problems of high-grade fever that can happen after an actual virus infection. You may develop breathlessness. So, it's fine. A mild fever or a mild cough after a vaccine, you can fight it off after 2-3 days. That should not make you scared, like you should not take the vaccine. The benefits of taking a vaccine and being protected from COVID is much more higher than not taking the vaccine and just hoping that you will not get an infection again.
So one last question. The vaccination that we have already taken, first dose or second dose, will that be preventing the upcoming viruses and any other funguses? Sir?
Yeah, this vaccine won't help you from fungus. First point. Now it will help you from prevent your body from getting any COVID vaccine or COVID infection. So all these new variants that are getting generated, they're usually close to the older variant. They'll have the same genetic makeup. Basically, they have the same kind of antigens are protein particles that are on the vaccine. Although when you see any photo of a vaccine they show on news, they show spiky particles. Those spikes are basically antigens that go attach itself to the lung tissue or in your body that causes all this infection. So and the genetic makeup of all these vaccines, all these viruses are the same. So when we take the vaccine, they usually cover most of the variants that can happen. If there's a variant that is completely new, that is completely different from the older variants, then the vaccine may not help. But at present moment, they are usually the present vaccines, they cover most of the variants that can be generated. Like the Covaxin can cover 300 variants of the same virus. And the Covishield also has 95% of effectiveness towards COVID-19. So most of the variants presently are covered by the COVID vaccines that have been given by the government to the general public.
So one last question we have. One of the students' father's friend was a healthy man who had no symptoms but tested positive, and then he gets to know that that his lungs were fully affected due to virus, and now he should get his lungs transferred. So can you ask sir about what to do in such cases, like how to deal it before and after such case, when if the lungs are totally affected due to virus, and now it is suggested they have to get lungs transfer. In such cases, what can be the before and after, what should be the preventions to be taken, sir?
I don't get it. Like basically, they want to know if how to prevent COVID disease.
No, sir. No, sir.
If the patient requests, okay, yeah. So okay, so if the patient is requiring lung transplant, that means the infection is so much that there is no, like how much of a treatment we give, there is the amount of damage is so high the lung can never recover. In such patients, we'll do lung transplant. In those patients, the main thing will be that they will obviously already be in ICUs, so they will be getting treatment accordingly. So from our side is there will be a donor and recipient. So even after getting the lung transplant done, they will be on immunosuppressants throughout their life. So for them, chances of getting even a mild infection is very high. So in such patients, the amount of care that has to be taken will be too much.
Oh, thank you, sir. Thank you so much. Neha,
yeah, no problem.
You can continue.
Thank you, sir, for your valuable information, which made us more aware about the fungus and making us health conscious. Now, I would like to request our beloved principal ma'am to give a presidential speech.
A very good evening to all of you. I'm actually sorry I joined late. YRC wing of our college had organized this webinar on creating awareness about the black fungus and the other funguses which are coming as the side effects of COVID-19. And during this pandemic, health has become a more important thing. We used to say health is wealth, but now health is the only wealth for everybody. So it is very important that we all be aware of things which are going on in and around due to this pandemic. Okay, and the another thing is like about oxygen levels also. Actually, when YRC team was just thinking of as to what kind of programs have to be organized, the first thing, Youth Red Cross Wing always works for creating awareness among general public relating to different things which are there in the current situation. So thinking this, they took up this topic. We actually had Dr. Darshan Shetty, who gave a brief about what the fungus is all about, why actually the fungus happens, okay, and what are the side effects of it. I just attended QA session also. It was very nice, sir, which helped a lot of us to clarify with our doubts. These kind of sessions will actually help the patients, okay, and help the general public to directly speak to doctors and get updates on it. Because normally what we see is we see in the media, but we will not have any kind of clear information on things which are going on now. On behalf of our Shishapram Educational Trust, I wholeheartedly thank you, sir. Thank you so much. And I also congratulate and thank the convener of Youth Red Cross, Manjushri ma'am, and all the volunteers of Youth Red Cross who have organized this wonderful informative webinar for all of us. Thank you one and all. Over to you.
Thank you, ma'am. Now, I would request Vandana to give the vote of thanks.
Good evening to one and all present here. On this wonderful evening, I would like to present the vote of thanks. I take this golden opportunity to thank the respected speaker of this session, Dr. Darshan V. Shetty, sir, for giving this webinar in his busy schedule. We will cultivate the advice you gave us, sir. Thank you, sir. I would like to thank our beloved principal, Professor Vidya Shivanava, ma'am. Thank you, ma'am.
Thank
I
you.
would like to thank our YRC program officer, Assistant Professor Manjushri, ma'am, for organizing this webinar. Thank you, ma'am.
Thank you.
I would also like to extend my gratitude in thanking our teaching faculty members, volunteers, and one and all present for making this webinar a resounding success. Once again, I thank one and all present here. Thank you.
Thank you, Vandana. Thank you, one and all present.
Thank you all. We can end the session.
Thank you, sir. Thank you for coming to our institution and giving us the peaceful information. Ma'am, we can end the session.
Yes, ma'am. Thank you all. We can end the session.